In this episode of What's in the Doctor's Bag, we will cover epinephrine. Epinephrine isn't a usual go-to drug, not so much because it doesn't work, more so because its side effects, such as rapid heart rate, are worse than other available medications. The one disease epinephrine is the #1 medication for is a severe allergic reaction, otherwise known as anaphylaxis. When the body encounters an allergen, such as shellfish, peanuts, or bees, a type of cell in the body called mast cell releases a chemical called histamine. This chemical causes the body's allergic response. When the chemical release is overwhelming, that will cause anaphylaxis. Anaphylaxis results in the patient's blood vessels widening, their airways narrowing, and their skin becomes covered with hives. Let's briefly cover the dangers of these symptoms. The point of blood pressure is to keep our blood moving all around and throughout our body. That way, nutrition is distributed from the top of our heads and down to our toes. If blood pressure is too low, then vital organs such as the brain won't receive enough blood, and the brain not receiving enough blood is bad for our health. The point of our airways is to transport oxygen from our noses to our lungs. If oxygen doesn't reach the lungs, then vital organs such as the brain won't receive enough oxygen, and the brain not receiving enough oxygen is bad for our health. Fortunately, hives are not a critical condition, but nevertheless will be addressed. Our blood vessels have receptors on them that, when activated, cause the vessels to constrict or narrow. Now comes epinephrine. Epinephrine can latch onto these receptors and activate them. Next, our airways have receptors on them that, when activated, cause the airways to widen. Now comes epinephrine. Epinephrine can latch onto these receptors and activate them. Last, epinephrine prevents the body's mast cells from releasing additional chemicals. This will help with the blood pressure and airways, but also address the hives. Anaphylaxis is dangerous. That is why people with known severe allergies are advised to carry an epinephrine pen or EpiPen with them at all times. Now we will finish with the side effects. Anyone who has experienced stage fright can list most of them. These include anxiety, sweating, heart palpitations, high blood sugar, and pupil dilation. This concludes the video. As always, thank you for watching. Comment below on which topics you are interested in learning more about. Also, leave any feedback on how these videos can better serve you.